Hello, my name is Jakirin Baines and I'll be doing a crisis communication case study on Johnson&Johnson's 1982 Tylenol incident. I'll be covering the background of Johnson&Johnson, the background of the 1982 cyanide-laced Tylenol incident, and how the Coombs situation crisis theory was applied to the incident, the cooperation and damage control that Johnson&Johnson had led, and turning a crisis into an opportunity, and how Johnson&Johnson had managed to do so successfully, and also the lessons learned by Johnson&Johnson and other organisations. Johnson&Johnson is an American pharmaceutical and consumer packaged goods manufacturer founded in 1886. As of 2015, Johnson&Johnson operates in 60 countries and retails in over 175 countries across the globe, making worldwide sales of $16.3 billion US. In 2015, they took the crown as the world's largest drug and biotech company according to the Global 2000. Johnson&Johnson found themselves in several crisis situations and still do to this day. However, one of the most prominent cases was the 1982 incident, which found 7 people dead after consuming extra-strength Tylenol capsules containing cyanide. This prompted a strong response from Johnson&Johnson, with over 31 million bottles of extra-strength Tylenol, which was the equivalent of $100 million worth, being pulled from shelves across the United States. Production of the capsules and advertising was also abruptly stopped. In 1982, as you can probably tell, Tylenol was a big contributor to the pharmaceutical industry within the US. Tylenol capsules ruled 35% of the US over-the-counter analgesic market and contributed up to 15% of Johnson&Johnson's overall profit. After the cyanide incident, shares unfortunately plummeted to a dismal 7%, which resulted in a tremendous loss in sales and a hit to the brand's reputation within the pharmaceutical market. Johnson&Johnson cooperated with authorities of Chicago, which is the Chicago Police Department, the FDA and the FBI on solving the case. With the recall of millions of products, investigators found that the cyanide was only to be found in one batch within the Chicago area. This led the authorities to believe that the incident was not caused internally, however externally. Johnson&Johnson regarded the consumers and shareholders as their number one priority and disregarded any temptation to relaunch the products until the investigation was fully solved. Although Johnson&Johnson knew they were not responsible for the distribution of cyanide-laced capsules and the deaths of 7 consumers, they took full responsibility in order to ensure the safety of the consumers. This action reflects on the 1940s Johnson&Johnson credo, which states that responsibilities were the consumers and the medical professions using its products. And this is a quote from the credo: "We believe our first responsibility is to doctors, nurses, and patients, to mothers and fathers, and all others who use our products and service." A theory that Johnson&Johnson used effectively to avoid public scrutiny was the situational crisis communication theory, which is also known as SCCT. This theory was created by W. Timothy Coombs and was used to calculate a crisis through evaluating the type of crisis, and understanding the threat of the crisis responsibility, and overall outcome of the reputation of the organisation. Johnson&Johnson had effectively used the Coombs confession posture by taking responsibility of the incident and offering a public apology. Lucky for Johnson&Johnson, a key attribute to the crisis management was the Johnson&Johnson credo. Had the company not had a credo in favour of consumers over profit, the company may not have been so successful in overcoming this crisis. In fact, they probably wouldn't have been around till this day. Johnson&Johnson also followed the SCCT crisis clusters by following the preventable cluster. The preventable cluster is a crisis type and reflects on the organisation acknowledging the issue and taking full responsibility of the crisis. Johnson&Johnson followed the human error product harm crisis type and took responsibility of the deaths. They also did a public apology on behalf of the organisation to the stakeholders. However, by taking full responsibility for an incident not in their fault, they unconsciously used the victim posture and were praised by the public for their integrity and professionalism through the crisis. Although The victim, the victim cluster doesn't necessarily look in the favour of the organisation. They still did take full responsibility, so it's a bit of a mix between the preventable cluster and the victim sort of cluster as well. Okay, so the cooperation and damage control that Johnson&Johnson had utilised, and that's leadership, cooperation and open communication. Through leadership, the former Johnson&Johnson chairman Burchand led the crisis personally by dealing with the coverage and the FDA. The involvement on senior leadership showed the public how seriously the company was taking the crisis. Through cooperation, Johnson&Johnson also cooperated closely with the authorities, the Chicago Police Department, the FBI and the FDA in solving the murder case. This example of following through with the investigation and also taking responsibility showed the public their cooperation, putting the health of the public first and foremost. And lastly, open communication. The company also kept the public updated with the regular media releases throughout the crisis. Again, this was done through continuous communication from the leaders of the Johnson&Johnson and the investigators. Not only did it help with keeping the consumers updated on any other issues or other recalls, it showed leadership and control of the situation. After the recall of 31 million of the products and the cost of millions and millions of dollars, Johnson&Johnson spent an additional millions on issuing national warnings across the US, and this was again done through media releases. And this was to urge customers to withstand from consuming Tylenol. So you can imagine at this point they were taking full responsibility of the public's health by generally stopping the public from buying and consuming their own products. They also established an official hotline for customers, and this was to answer any consumer questions in regards to the Tylenol issue, but also ensuring customers that other Johnson&Johnson products were not affected. Turning a crisis into an opportunity. At this point, Johnson&Johnson successfully handled the crisis through taking responsibility, cooperating with authorities, regularly updating the public, and providing a hotline for troubled consumers. However, what Johnson&Johnson was most credited for was their action of taking crisis into an opportunity. Johnson&Johnson worked on a solution to provide a safe distribution of over-the-counter medicine, and after 3 months of recall, reintroduced Tylenol with tamper-proof packaging. This further reassured how dedicated Johnson&Johnson was into creating a safe relationship with the consumers and of their products. Of course, the trend of tamper-proof packaging spread worldwide as every over-the-counter drug had tamper-proof packaging also. Johnson&Johnson recuperated 70% of their shares in 5 months and recovered their reputation as one of the leading companies in professional healthcare and pharmaceuticals, and they still do to this day. Johnson&Johnson and many other organisations learned a valuable lesson through this crisis, showing control of the situation by reacting quickly. Had Johnson&Johnson not reacted quickly as they did, there may have been more casualties in the Chicago area. Their credentials, their integrity and their reputation would have possibly been diminished, and of course a larger crisis to deal with. Putting consumers and public safety before sales and profits, and that's something that they did, and it's been stated in their Johnson&Johnson credo, and they did go by the rules of the credo and did show that to the public. Taking full responsibility for any issue in regard to your organisation. Now, this is whether it's an internal or external fault. It's important to not be in denial and to take full responsibility. And Johnson&Johnson did so by using the preventable cluster, which was the type they used was the human error product harm cluster. Had they not used that possible cluster and used the denial one, there would have been a different outcome to the situation. So being responsible is very important. And lastly, flipping a crisis into an opportunity will diminish the situation and restore the organisation's integrity, and they did so by introducing tamper-proof packaging, and in fact they did beforehand by stopping the relaunch of the products and holding it back for 3 months during the investigation. Okay, and that is the end of my presentation. Thank you for watching and good luck with your studies.